Iran reported its first confirmed cases of SARS-CoV-2 infections on February 19, 2020 in Qom, where, according to the Ministry of Health and Medical Education, 2 people had died that day. Early measures announced by the government included the cancellation of concerts and other cultural events, sporting events, Friday prayers, and closures of universities, higher education institutions, and schools. Iran allocated 5 trillion rials, equivalent to $120 million, to combat the virus. President Hassan Rouhani said on February 26, 2020 there were no plans to quarantine areas affected by the outbreak, and only individuals would be quarantined. Plans to limit travel between cities were announced in March 2020, although heavy traffic between cities ahead of the Persian New Year Nowruz continued. Shia shrines in Qom remained open to pilgrims until 16 March.Iran became a center of the spread of the virus after China in February 2020. More than 10 countries had traced their cases back to Iran by 28 February, indicating the outbreak may have been more severe than the 388 cases reported by the Iranian government by that date. The Iranian Parliament was shut down, with 23 of its 290 members reported to have had tested positive for the virus on March 3, 2020. On March 15, 2020, the Iranian government reported 100 deaths in a single day, the most recorded in the country since the outbreak began. At least 12 sitting or former Iranian politicians and government officials had died from the disease by March 17, 2020. By March 23, 2020, Iran was experiencing 50 new cases every hour and 1 new death every 10 minutes due to COVID-19. According to a WHO official, there may be 5 times more cases in Iran than what is being reported. It is also suggested that U.S. sanctions on Iran may be affecting the country's financial ability to respond to the viral outbreak. On April 20, 2020, Iran reopened shopping malls and other shopping areas across the country. After reaching a low in new cases in early May, a new peak was reported on June 4, 2020, raising fear of a second wave. On July 18, 2020, President Rouhani estimated that 25 million Iranians had already become infected, which is considerably higher than the official count. Leaked data suggests that 42,000 people had died with COVID-19 symptoms by July 20, 2020, nearly tripling the 14,405 officially reported by that date. In August 2021, the pandemic was in its 5th wave in the country with more than 400 deaths in one day according to the official reported statistics.